As mentioned before, indicators, tracking, and evidence building for climate and health policy is the topic. And what I want to do is work through over the course of the next 40 or 45 minutes or so is what does this mean in terms of the way in which we tackle the topic, build information, and understand it, and then to illustrate that through the lens of Countdown's indicator from the 2024 report. So first, really, what role do indicators play in evidence-based policymaking? So the interest here is we're going to track information change in order to be able to convey that towards areas of action, right? And there's no point in tracking an indicator if nobody cares about it. We need to ensure that there is some reason it speaks to an audience that has an interest. The next is how we might build robust climate and health indicators. So again, knowing that there is a solid scientific evidence base behind why information is going to be used. And then we'll be exploring different needs. So this really, in the climate space, thinks through, well, look, we have the big ones like climate change itself. We have things around the adaptation space. We also have mitigation, clearly something which I'm interested in within all this, but also those that speak to different audiences. So thinking about kind of the economics or the policy making and politics of climate change and health. And again, to use the lens of Countdown as a way of showing some global best practice. So why do we need this urgent evidence base? Well, look, we know climate change poses an enormous threat. We know that many of the types of tipping point and hazard indicators are being reached, and really red lights are blinking all over the place for the red light that we do track on indicators, and that we have, between now and 2050, a limited window to be able to make changes that not only are going to keep our current climate within realms of reason, is that also a lot of people are being affected on an annual basis. In fact, this is an underestimate, really, in terms of those who are being, the diseases that are being triggered, harmful events, emergencies, et cetera, that are climate related. And ultimately want to build that evidence base to target specifically interventions that can help address climate change, that can promote health, and that can track progress towards those. So it is a complex climate health relationship. It's an environment where there are many different voices that are going forward. And so to be able to cut through that, clear insights is very valuable. So what are indicators? Indicators are quantifiable characteristics. They provide evidence for describing population health status and tracking those changes over time. So there is a premise behind what it is that we need to track. There's information, it needs to be quantifiable, verifiable, et cetera. So the main functions will be that it has a measurement tool behind it. So designing an indicator means looking at different information, different data sets, different ways in which we calculate different outcomes, et cetera, but also making them specific in this case. We need to know the climate health relationship. And a lot of that is emerging still in some cases, but also quite readily known. If we think about exposure response functions in many cases and climate activities, whether they are contributing to climate change or whether they're helping to adapt to climate change, have that type of relationship, exposures and responses, even when we're talking about non-environmental exposure. So that could be kind of political opinion, that could be information. Another is that they need to be a vehicle for communication around complex data. One of the challenges that we often face as scientists is that we have many, many circumstances where we have to, intuit through scientific processes what it is that's going on, because these are complex underlying relationships. An indicator, in a way, is attempting to simplify in some respects the message, but not necessarily undermine the complexity of the data underneath it. So it's quite important, in this case, of the communication of what information you're finding. And lastly is, while we can communicate, we also have to focus on what change could occur for which the indicator is going to be sensitive to. So being able to talk about fossil fuels and contribution to air pollution and that relation that has to respiratory lung functions and risk around health outcomes for elderly or or for children is important. But what's the policy mechanism that can help address that? So being able to channel this information towards specific decision-making processes around, for example, looking at power stations and being able to come with emission control mechanisms to limit the amount of particulates that are coming out of, say, a coal-fired power station. This is the function of indicators, that they are specific, that they have measurable, that they're communicable, that they have a specific policy focus towards them as well. So indicators need to be reliable. They need to predict these relationships about environmental conditions and human health outcomes with consistency. One of the ones which we often use in this type of framework, with WHO and others have promoted, is the DIPSIA framework for climate and health. So that means that we focus on drivers on one hand, what are the socioeconomic factors. Fossil fuel doesn't just burn itself. And obviously, there is a social interest to do so, which is to do with power, which is to do with economic drivers, which is to do with livelihoods and well-being, etc. But we also have pressures, the environmental stressors that, for example, emissions of fossil fuels, yes, but they relate to CO2 and particulates. There'll be things like land use changes to do with animal and livestock rearing, etc., or climate change, forest fires for land clearance and issues like this. So then there's the environmental conditions. So it could be that those same circumstances in one place will be better or worse than another. So causing forest fires, for example, in the Brazilian rainforest is a very different thing than causing wildfires in Southern Europe. The exposures, which is really where, if nobody's around, it's not necessarily going to be a direct problem for health outcomes if the exposure is not met with human contact. So that's where it's particularly important to talk about climate change as a personalized health relationship when we talk of the climate and health area. What's the effect? Right after this in exposure within these settings with these individuals, is it that there is a direct health outcome that creates, for example, in flooding, a risk to life? Is it that we're talking about heat, where there is also a risk to life, but also one which exacerbates current morbidities? If you're living with, for example, diabetes, or you have mental health issues, there'll be different relationships. So we need to understand the effects that these have. And lastly is actions. Again, as mentioned before, an indicator needs to lead towards some form of action, some form of intervention. So what is it that we can put within this framework? So ultimately, we need to ensure that this information is of a high quality. There is no sense in developing indicators that don't have, as I said before, that scientific basis behind them. So we might think of indicators in these different ways. So we might have environmental indicators that are much more about tracking the climate hazards and exposures. And these could be heat waves, for example, or air quality indices. Then there's the health impact side, being able to measure these outcomes, for example, mortality, vector-borne disease incidents, things that are very much of the standard epidemiological approaches, but have a relationship to that environmental indicator. The other could be around vulnerability. So whom among these populations are at the highest risk? Maybe they're not directly exposed to these conditions, but if they were to be, these would be the ones with the highest risk. This could be things like healthcare access, for example, in flood zone areas. Is there ability to have ambulatory care when that's needed? And response indicators. So again, looking for ways in which we don't necessarily have to experience the exposure change, but could also look at ways in which we can have forewarning indicators that, for example, adaptation, monitoring, or mitigation actions that help to indicate something that is happening before these outcomes occur. So why system thinking matters? I think I've got a few things in between here. But first, having systematic tracking is important because, for example, early warning system capabilities really about trying to understand as things are emerging, right? For example, we don't every day we might look at the weather, we might look at our apps on our phones and say, okay, is it going to rain today? What's the temperature going to be? You're preparing, and that's an early warning system, right? Most of us are not working on the basis that the weather happens as it happens, is that we have some forethought to that. Attribution science, linking these specific health outcomes, for example, health relationships during heat, is to make that specific attribution to as heat waves occur for those vulnerable individuals, these are the things that they should be concerned with. And so when we have, for example, heat alerts happening in many countries around the world, India being among them, is to be able to forewarn individuals who are at risk and therefore be able to have some information to take action from. With that is a policy accountability, because if we expect that decision makers should be informed, they should make informed decisions with the best information available, we also want to be able to track progress around that. So Are there goals, for example, that have been set out that individuals at a high risk will be within walking distance to cooling stations during heat waves, for example? And lastly, is to be able to track, for example, resource allocations. If these are identified as goals and we have a concern around accountability, we need to be able to put in place information to help to identify where that is happening. So, example, the priorities around resource allocation. When we're connecting these things together, we've got health, we've got climate, got socioeconomic data streams, but often these things are happening in silos. We know that one department, one municipality, et cetera, may have a way of making decisions, and is that related to other interacting parts of the system? So it's quite important that indicators not only help to uncover change and risk to change, for example, but also be able to work within the socioeconomic data decision making that they're in. So different ways in which we might apply this. So we've got health surveillance data. These are often case routine or standardized among, say, health professionals. They're tracking information. This could be around hospital discharge record, national health surveys, etc. But then these need to be related and coupled with climate environmental information. So for example, meteorological monitoring stations, temperature, precipitation, do we have detailed data about this? We have the amazing capacity of remote sensing now that offers so much more information at really high resolutions, which can be used. Air quality monitoring system, for example, but they go beyond that. There's going to be the socioeconomic indicator and data streams as well. So there's interesting opportunities that continue to expand. It used to be that we would say, look, the data is not available. We're going towards more data availability, but we have to be able to interpret that. And we still need we still have the need for on the ground local understanding of what is kind of important to those settings. So how we might approach this in terms of building evidence, one is we might have an exposure assessment process, so quantifying those populations that have risk towards climate hazards. We devise modeling, right? Because although tracking is extremely important, we need to have some ways of understanding what's that longer term relation and link, or how is it in different areas where we don't have the same amount of information. Then we can do vulnerability mapping, for example, saying who is at the at risk in these different locations to help us identify and track and target. The important thing here is trend analysis. An indicator that is calculated once might be interesting, but if we can't see change over time, then it's not going to give us the full picture of how we're addressing or what are the causes of different problems or exposure conditions that we're facing. We need to be able to convert that into policy. So ensure that the findings can be actionable and recommendations. And lastly, extremely important is because we have challenges around the realities of our own socioeconomic conditions, the equity concerns are extremely important. So being able to understand that not all individuals have the same levels of protection, that they don't all have the same level of information, that they are not able to respond in the same way, they may not have access to services in the same way. And so those vulnerable groups are at higher risk, in part because of inequities. So challenges, limitations as we carry on. Some of the key obstacles, we might have data gaps, right? We know this is a consistent issue that whether or not it's to do with there being no monitoring instruments, so there's no, for example, there's no survey, there's no routine reporting, there's no monitoring station. So that's a challenge. We might not have the full attribution. So this is something where, again, working in the health space, being able to say, do we have direct causal relationship? Well, for many types of information around climate exposures and health outcomes, they may be proximal, they may be part of an attribution pie, but being able to understand where we have uncertainty with an attribution and where we have a pretty good degree of certainty is important. And for communication purposes, that's extremely important. We do, as scientists, want to talk about uncertainty, but we also don't want that to undermine the position that we're in, which actually, no, when we talk about uncertainty with a lot of, say, environmental exposures and health outcomes, we're talking about degrees of uncertainty, which to the general public, we also want to make sure that they understand why we're talking about this risk. Temporal mismatches, again, we might have data that comes from one set of years to another set of years, and how these things are, for example, may change over time but have lags in them. So again, we know that a heat wave that may occur for some may have an immediate and direct impact, but for others, that might take a little while to work through the system. And to be able to have that as a part of the analysis process is quite important. We might also want to understand standardization. So when we talk about monitoring for heat, for example, around the world, there's different measures. And so groups like WMO, the World Meteorological Organization, or even the WHO are saying how it is that we might want to understand temperature in different locations, how it could be measured so that there's more consistency. But then there's also every reason to have a localized system as well, because it may be best understood by those in that location. So solutions towards this, as I mentioned before, data gaps, much more is being done around satellite-based monitoring that's going to really help to reduce that ground stationary dependency. We have better ways of being able to do machine learning. So this is where, again, people talk about, AI. What does that mean? Well, in the cases, for example, of large data processing, we can do pattern detection in much more sophisticated and efficient ways. So this is really beneficial, but we also still need that kind of clear connection to health outcomes that are done through clinical work as well. International frameworks for promoting these methodological harmonizations. This is something which is going on right now in the climate health space with the WHO, where they're both working with experts around the world, with government interests to try and devise a series of standardized guides and methods for being able to develop indicators in this space. So these are extremely important because it gives people the certainty and a reference point to work with. So I'm now going to give some examples for the Lancet Countdown so that we can go through these and give illustrations of the different types of indicators. I've got quite a few, but I'm not actually going to go through all of them. So I'll just be looking at a few. So the Lancet Countdown, for those of you who may be aware, its primary interest is to be able to understand how it is that we are contributing to and responding to climate change, how it is that we're taking actions to address climate change or inaction, and what ultimately health relationships these have. We also want to understand the financing and economics. So again, these are indicators that speak to particular audiences, but all of them have this primary interest to be able to understand how it is that, yes, the greatest global health threat is emerging in terms of climate change, but also how it is that actions that are taken to address climate change are increasing or reducing our risk in health terms. So we have an annual report which has been published since regularly 2017, pardon me, 2016. And in doing so, we have devised over time, this is as it were, live year by year form of indicators development and publication. And in that period, we've also expanded the reporting that we have. So we've gone from a single report coming out every year to a set of reports, which are the global indicators and then a series of regional ones. Why? Because ultimately, again, having stakeholders in different parts of the world, having the information and the data that speak more to their realities and their circumstances. So ensuring that the countdown is communicating effectively those indicators. So we have 5 working groups, of which we have a different variety of indicators that are there. The first one being very much around climate change, looking at how climate conditions create health hazards, exposures, and impacts. We have another working group around adaptation, so looking again both at the preparedness of different locations around the world to parts of the adaptation framework, but also the resilience that systems have towards changes, i.e. climate change. The working group that I lead, mitigation, is looking at the contributors to climate change in terms of the emissions, but also what they're driving from. So, for example, the fossil fuels or diet and land use, these are areas which we look at. And there's a indicator set around economics and finance, again, being able to understand the implications that actions or inactions have in terms of harms, but quantifying those in a different way than health. It's about the economics. For example, the value of life in certain ways, or the cost of treatments, or the cost of resilience. And lastly is political and public engagement. And this is important because the question around these indicators is whether or not people understand the issues in the way that the science does, whether they are being communicated in different ways, whether they're part of the discussion and the debate, and being able to pull these together with clear health messages every year to ensure that action is being undertaken. So ultimately, within this framework for the Lancet Countdown, we approach with methodological rigor. So every indicator that's devised, we have a review process. So for example, someone says, look, there's a really important area that we need to be tracking globally and or regionally. And we have this great idea about how you can do that. And so what we do is we invite methodological papers. We say, okay, we have a concern, which is one, we want indicators that track things over time. They can be done consistently and they can be done every year. But how is it that you're going to do that? And so these method documentations are submitted to the working group leads, who then invite peer reviewers to be able to evaluate, the science and the credibility of the indicator being proposed. With that is that these are meant to be kind of publicly available. We expect the information is to be shared to those for whom we're speaking, the wide public audience. We have a dashboard of indicators that we produce every year. The other is that we want to ensure that there's geographic representativeness. Now, again, it's mostly, we say 40 countries. It's primarily around, in global or regional context, what's an appropriate way to track this with coverage that makes sense in that location. We also want to make sure that there's some form of policy integration. So I mentioned before that we could be tracking some really scientifically important issues, but if they're not well known about, this is either A, an opportunity within an indicator to speak about this, but we need to speak about it in a way that makes sense to decision makers. And so whether that's the healthcare sector, whether that is policymakers at the local or national government level, those are the ones that we want to inform with this. And then also, how does it relate to other forms of guidance and actions that are out there? So being able to make that connection between these indicators and localized concerns. So every year, as a part of the global development and publication, we also have a series of country-specific briefs, which are there to promote these indicators. So, for example, whether there is one for, let's say, Peru, and Peru has these concerns around, climate, for example, rainstorms and the slopes around which people are building in and around the urban areas. This could be a part of that, specific country discussion. Okay, I'm going to pause for just a moment and carry on after a sip of water. So the next bit, what I'm going to do is show a little bit about the process of how we go through and develop indicator frameworks. And these are extremely important because we can't do these in isolation. We have to understand the full picture of what a framework is meant to try and do for indicators. And that is to make some consistency and put things together. So I'll use the mitigation framework as an example. This is a framework we devised a number of years ago, where we have, health concerns at the top. We have a series of interactions that, could be that we've got co-benefits. Why do we care about undertaking action in mitigation, climate change alone? Well, because there are going to be potential benefits that tackling climate change have. We also have a series of intervention areas that we might choose to track within. And here within the very bottom part is, all right, what are the different contributors to climate change emissions that we should be considering? So urban planning or transport, et cetera. Now, this is a framework that works so far, but we also know that we're not tracking a lot of things that we could be tracking. So how do we build those in within a framework that's cohesive and coherent? So it could be what we've done in the recent round is to undertake a review process that says, right, how is it that mitigation, climate, and health are being understood within different frameworks? So here's an example from my colleagues in South America that are looking at it in a different way. In that same DIPSIA framework method that I was suggesting earlier, we might have greenhouse gas emissions on one hand, but a series of sectors that are interacting. Do those who increase the amount of greenhouse gas removal or sequestration, or directly reducing it, for example, by simply not emitting? We might have mitigation actions that relate to that. So, for example, what types of sequestration and removal areas are there? For example, it could be to do with agricultural and soil management or forestation, but then it could also be with mitigation actions, as I said before, improving land management to ensure that, for example, livestock and ruminants are kind of not taking up as much land. And what's the relation to this might help to health determinants? There's a whole host of these here, but it could be in the relation to diet, for example, and that specific relation to health outcome about in terms of, yes, we consume diet, what does that mean? Another example of this could be in Europe, where we're saying, look, we have a different framework to work within. Neither one is right nor wrong. An example here, levers of change, we look at, okay, governance or scientific and technology, et cetera. And how do these achieve in terms of different goals, for example? So in Europe, there are a series of goals that um, kind of describe how it is the European economy and setting will kind of transition towards net zero. And as a result of that, what are the different ways in which we'd expect to see change occur? And what's the exposure pathways to health outcomes? So, for example, in buildings, we might say buildings are now more energy efficient. They can stay warmer, they can stay cooler. And as a result of that, what does that mean for that indoor environment? Well, it should be that people living within them should be better protected from the outdoor elements, but within a comfort range that is health promoting. And what does that lead towards in terms of, say, changes in mortality risk or experience of morbidities? It could be also that we look at them in terms of interactions and at a more local level. So here, adaptations, we might look at climate change interventions, for example. What does bike lanes offer in terms of climate emissions outcome? Well, having more bike lanes could induce more cyclists, could reduce the amount of uh, motorized vehicle transportation. That has a reduction in CO2 emissions, air quality, and respiratory diseases as a result. So another example of a framework through which you can identify and build indicators. So for example, here, there's a whole host of indicator areas that one could describe and determine. Other examples, which I won't go through very much, but just in terms of, say, biodiversity, we relate these to climate solutions and the co-impacts that that might have. Another could be around health and non-health climate mitigation. So again, a framework for the WHO, looking at different energy direct and indirect around mitigation, for example, and saying, okay, what are the induced effects that we could look at? So there's a whole host of information in here. These are not yet indicators. These are indicator areas. Another could be around understanding how health around socioeconomic. So again, saying, well, how is it we would understand concerns for health in an economic lens? So health impact and costs and values, et cetera. So in this one, which is what we're working with in the mitigation side, we might say, well, using that initial framework we described, we have sectors, we have greenhouse gas emissions that we want to understand. What are the policy interacting areas in terms of, say, soil management or dietary policies? What are those in terms of water quality or in terms of availability of nutrients in food? And what are the health outcomes that those might relate to? And then we can expand that across a series of indicator areas: agriculture, food, waste, energy, et cetera, linking those to a whole host of different outcomes. But actually, when we start to talk and get into the indicator space, there's much more detail, right? We need to be able to understand within agriculture, within land use, within those carbon sinks and losses, how is it that we're going to measure something related to CO2 emissions around deforestation? What does that mean in terms of the health relationship that that might have for people who, for example, have access to those spaces? So we get more and more precise, but we also have to have an understanding of where it is that we would have a concern for that. So land rights and conflicts, interactions between land use and well-being on one hand could also lead to losses in terms of access and livelihood. So these are complicated, and therefore we need to begin the process of unpicking them. And ultimately, what we'd like to lead towards is a whole host of indicators, such as we find in the Lancet Countdown, where we're able to describe quite, as I say, complex interactions over time, convey them in a way that understands to a general audience, a policy audience, and a health audience towards the things that we should be concerned with or that we should do more of. So this is some examples from the 2024 report for Lancet Countdown. Again, we have a whole host of audiences. We have a whole host of authors. We have 56 indicators across these different domain areas. So we also, as a part of this, create these key messages. So in this case, we're highlighting that 15 of these indicators, right, again, around climate change, health, exposure, et cetera, are placing people at risk. And not only that, they're at the highest level, and this is something that we're seeing consistent over years, and hence the reason why change and trends are extremely important. Are they getting worse over time? So we're knowing that not only are they getting worse, but within this data information indicators, we're able to describe much more about whom is being affected. Those who are disadvantaged in terms of their access to services or their livelihoods. These are really important part of the policy message around indicators. We can also devise a kind of a highlight around, for example, this increasing risk and who is responsible, right? So decision makers on one hand will be those who work within organizations, they'll be working within local governments, national governments. It could be those who sit aside those governments and aside those decision makers in terms of, say, financing, for example. And so being able to direct the information towards particular user types, again, is an important part of what the indicators are meant to do. In this case, we also want to try and highlight that there are beneficial efforts that are underway, that we don't want to leave people with an impression that all is lost, because it's not. There's a lot of good reason why current actions are yielding positive outcomes, but we need to see those expanded. And again, that's where an indicator can help to say, among whom are being protected, and can we increase that so that we have more protection, more health promotion in these indicator areas. So as I mentioned before, consistency over time. We've been really grateful that we've had the support from the Wellcome Trust over all these years, but initiated in our 2016 report, we'll be tracking through to our current report in 2025, coming up later this week, is to be able to promote how these things are changing. Obviously, lots of collaborators from around the world, and it's extremely valuable to have all those inputs of experts. So this is our kind of indicator framework, as it were, for the working groups that we work with. So the first one in the core, as I mentioned before, was the climate change. It's the reason why we're coming together in this, because of environmental exposure changes, but they're being caused by, for example, mitigation areas, so contribution to climate change. We have the adaptation areas, the effect that we're experiencing, economics, and then political context around which. So within each of these, I'm not going to dwell on these. I just wanted to show that we've got a lot of information that comes forward within this tracking monitoring system, whether that's through heat and health, extreme weather events, climate suitability of infectious disease, food security, nutrition. But what I want to do is talk about a few different types of indicators. So in this one, this is a heat, and it's specific to a group, right? We're looking at people over the age of 65 and newborns. So these are the concern around, for example, on one hand, infants, just showing this data. So infants and adults over 65, when they're being exposed to alert conditions. So how many heat waves are being experienced? And so here we're able to track, for example, a selection of countries around the world and look at that in a measure which is around, say, billions of person days. So as an indicator, being able to convey, okay, it's a person day of heat exposure. And when we have lots of people being exposed, therefore we have a lot of person days. And during these heat wave events, we want to also talk about the change in heat wave occurrence, right? Because is it worse than it was before? Is it better? What's going on? And so even if you can't get into the details of an indicator like this, what you see is on the figures something that is going from one hand left low in the 1980s to on the right hand much more. Okay, so as a lay reader, you might say, well, I understand that infants are at high risk. I don't necessarily understand the billions of person days, but maybe a health professional better understands this. But I see these countries, I see this thing that's occurring as a trend going up, right? So this is one where we're able to talk about accumulation of exposure to at-risk individuals and how that's changed over time. Another might be, for example, around an economic related indicator of work loss, right? So people again can understand that during heat and elevated heat, capacity to do work, very literally being affected by physiological abilities or impairment cognitively, means that we're not working at the way that we might once have. And so in this case, this heat exposure accumulates again during work hours to then say, well, if it's too hot, or if people are not working as effectively as they might have in terms of productivity, we can also count that. And it's a relative measure in this case. So we're saying that there's perfect working conditions, and then there's those that are not perfect. And that's what we're trying to measure, is that difference, and accumulating that difference in terms of work hours is a way that we can say not only are they weren't hours worked, but they're work hours lost. And so effectively that translates into productivity and economic, but also more emotively as livelihoods. This means that people weren't able to work in a way that would have brought them, for example, more economic power and prosperity. So another one might be heat-related mortality. So again, this is a relative measure of change. And here we're comparing heat risk among elderly from one set of years to another. So we're saying the average of a period of time, 10 years, compared to current today. And so what that allows us to do again is take a relative comparison. So if climate change is happening that is accumulating in terms of heat and changes in the atmosphere that's driving these different conditions. That was the before, and now we have a now. So relative measures again help to say, well, it's different than it was. And this way in which we're looking at those again who are at the highest risk. And here in a geographic setting, we're illustrating those across the world to be able to show where risk accumulates and why. What's the underlying concerns? Well, it could be to do with an elderly and aging population as a part of this. Not only that, it has to do with, for example, where heat is more concentrating. Could also be with urbanization, where people are gathering together into places that not only are affected by heat and by older populations, but you also have things like heat islands exacerbating these. So we can look at these relative measures over time, geographically distinct and population focused. Again, we can look at drivers of, for example, where wildfires, which are not directly being caused in the sense that um, climate change creates conditions where wildfires are more likely. Wildfires don't just ignite because of hot weather, they happen because of other things. For example, human behavior. So wildfires that are caused by humans creating risk in environments that are already elevated at risk. So change in fire risk days, for example, because of where we might have hotter weather and drier conditions, then leads to this intersection of human activity, which causes the potential for exposure. Lightning strike is another reason for this, but you can see again, these change in fire risk days may be occurring over time. But there's also things that relate to this, which is, well, what about population proximity to the forested areas itself, right? So if you have a lot of removal of forests, you can also affect that. Um, Drought, again, accumulation. So here we look at this type of indicator and we're looking at something around severity, right? So has the increase of exceptional versus very severe drought been changing over time? So up until, say 2006, we might be looking at this going, well, we've seen changes, yes. But there seems to now be something happening where, as we talked about before, kind of tipping points of something that's going on where we're seeing a lot of land area being affected by extreme drought. And so this is obviously hugely concerning. Now, in this indicator, we don't have the people component to this, right? We're just describing that there's a condition of change over time. It seems to be getting much worse. So this is again percentage of global land area, most elevated since the 1950s. So people have a really long time span to look at and consider how this is affected. There's a few more I'm going to talk about, but I'll just carry on for a moment to get to a couple of other ones. So again, it could be around infectious disease. This is something which, say, clinicians would be concerned with health officials. How is it that certain types of vectors, so mosquitoes, for example, are increasing the risk to different disease types, such as dengue, in which what's the driver for this? Well, it's interaction between people on one hand, but also the conditions where these mosquitoes are more capable of living and more capable of living in areas that had not previously had the same risks because maybe it was colder during the winter months and these mosquitoes were not traveling as far north, not being as successful to survive. Whereas now they could be living there all year round and increasing the capacity for that disease to be transmitted. We might have a few others, such as the adaptation side. I'm going to skip through these if I can, just to get to some mitigation ones for a second as well. So we might talk about some of these for a moment, but looking, for example, at drivers of climate change emissions, CO2 emissions specifically, in the fossil fuel world. So this is not a direct health outcome. This is something that speaks to the cause of, on one hand, climate change, but also we can relate this to other things that are happening within this energy system. So we might talk about CO2 emissions from the global energy system, but we also want to talk through specifics. What's the biggest concerns that we might have within this indicator area? Well, a lot of it's to do with coal. Coal has the highest amount of CO2 emitted for every amount of power that's being generated. And so we want to highlight this and say, look, this is one of the areas where real policy action needs to happen. So phasing out of fossil fuels on one hand, yes, absolutely. Phasing out of coal. Why coal? Well, one of the reasons why coal, I'll just go to that one, is because it's also a major contributor to air pollution. So being able to make that direct connection, for example, and you can see in these indicators, which a little hard on the bottom right figure, we see hashing for coal, liquid, and biomass. So the coal is responsible for still a lot of the emission and a lot of the attribution that that might have in terms of mortality around deaths per year. So we know that these have different health implications. We can be specific to the sector. We can be specific to the source. We can look at their attribution. So again, another type of indicator that helps convey this. I'm going to finish off in just a moment and perhaps leave with a couple of the policy related ones. So when we look at economics and finance, for example, we can look at different ways to convey the cost of these indicators. So again, this speaks to a type of audience where when we look at insurance losses, so this is during extreme events, weather events such as those unfolding right now across Jamaica with Hurricane Melissa, we can understand, look, those who have insurance and those who do not, and the equity dimension of insurable losses in climate events as compared to very high income settings, right, or individuals within those settings, as compared to those where there is no form of insurance. And so their losses are extreme. Their losses are felt immediately, and their livelihoods, in addition to the risk to life, means that their livelihoods are affected going forward. So again, we can use indicators that on one hand might be talking about climate-related events and the risks and hazard, yes, to health, but also another dimension around the economics of this and the socioeconomic concerns and conditions. How is it that we should be considering insurance and losses of in a global context? Right. Again, mentioned before, we look at labor capacity and we can create kind of economic indicators. So the loss of earnings that related to that, as mentioned before. So again, how is it that people are being affected? And here within the equity lens, we see that those in the lowest human development index countries have the highest losses because the types of jobs they might be doing, such as in agriculture, the weather events that mean that they're no longer able to perform their livelihoods, the heat conditions within which they're working affect their ability to perform that work. So again, these are a series of indicators within the last countdown as I finish off that just show the different ways that we might communicate this. So as a part of this effort, we have the report, but we also have this dashboard of indicators that we can show. So what I would suggest there, we can pause now for a few minutes. I'd be happy to take any questions. But on that basis, at any time, please go and look at the last countdown. We've got a whole host of information. And every year we produce these reports, which we hope people are really taking on. And on that basis, thank you very much.